Namaste. Let's understand the middle ear cleft. Middle ear cleft is a continuous air-filled space which is lined by the respiratory epithelium. It extends from the nasopharynx to the mastoid air cells. Let's look at the components. It's present like this. This is the proximal part and this is the distal part. The components are eustachian tube proximally, the middle ear cavity, and distally it has the mastoid antrum. Mastoid antrum is the largest mastoid air cell. This middle ear cleft develops from the first pharyngeal pouch. It is also known as the tubotympanic recess. Let me ask you, why are we even studying this topic? We are studying this because it is a route for infection spread. The eustachian tube block can cause otitis media in the middle ear. Any middle ear infection can cause mastoiditis. The three important functions of this cleft are ventilation of the middle ear, equalization of pressure, and conduction of the sound. Thank you and subscribe for more such videos.